Warm greetings from the High 10. It is Everyday Shenanigans on this Sunday, April 26, 2020. I hope you all are having a peaceful Sunday. I would prefer to talk about more positive things going on in our country on a Sunday for obvious reasons, the day of rest. But there is no rest for the weary. So I'm going to bring the said information pertaining to COVID-19. I want to send a very heartfelt message to my friend, Miss Elaine, and her husband and his family. The other day, they lost a brother, her husband, which is her brother-in-law. He passed away in Detroit, Michigan. At the moment, it's known that he had a blood clot, which caused his death. I do not know, or they do not know of any said information pertaining to COVID-19, but if I get that information and she would like to share that with me, I will share it with you all. But as you know, at the current moment, there have been a lot of deaths in that general area of Detroit, Michigan. And Detroit, Michigan has a high population of African American people, for those of you who stay in the know of demographics. So my prayers are with Elaine and her husband and family, and also with the people of Detroit and surrounding towns and cities that have been affected by COVID-19, sickness, and death. And I am also praying for those of you who are sick at the current moment and trying to recover from this virus, and also condolences to those of you whose family members and friends that have perished from COVID-19. The said information I'm bringing to you is a winded article, so please bear with me. It is by the Washington Post, and it is pertaining to stroke. And there is a link to COVID-19 and people testing positive of COVID-19. Young and middle-aged people barely sick with COVID-19 are dying of strokes. Thomas Oxley wasn't even on call the day he received the page to come to Mount Sinai Beth Israel Hospital in Manhattan. There weren't enough doctors to treat all the emergency stroke patients, and he was needed in the operating room. The patient's chart appeared unremarkable at first glance. He took no medications and had no history of chronic conditions. He had been feeling fine hanging out at home during the lockdown like the rest of the country, when suddenly he had trouble talking and moving the right side of his body. Imaging showing a large blockage on the left side of his head. Oxley gasped when he got to the patient's age and COVID-19 status, 44 positive. The man was among several recent stroke patients in their 30s to 40s who were all affected with the coronavirus. The median age of that type of severe stroke is 74. As Oxley and an interventional neurologist began the procedure to remove the clot, he observed something he had never seen before. On the monitors, the brain typically shows up as a tangle of black squiggles like a can of spaghetti, he said, that provide a map of blood vessels. A clot shows up as a blank spot, and he used a needle-like device to pull out the clot. He saw new clots forming in real time around it. "This is crazy," he remembers telling his boss. Reports of strokes in the young and middle-aged, not just at Mount Sinai, but also in many other hospitals and communities hit hard by the novel coronavirus, are the latest twist in our evolving understanding of the disease it causes. The numbers of those affected are small, but nonetheless remarkable because they challenge how doctors understand the virus. Even as it has infected nearly 2.8 million people worldwide and killed about 195,000 people as of Friday, its biological mechanisms continue to elude top scientific minds. Once thought to be a pathogen that primarily attacks the lungs, it has turned out to be a much more formidable foe, impacting nearly every major organ system in the body. Until recently, there was little hard data on strokes and COVID-19. There was one report out of Wuhan, China, that showed that some hospitalized patients had experienced strokes, with many being seriously ill and elderly, but the linkage was considered more of a clinical hunch by a lot of really smart people, said Sherry H.Y. Chow, a University of Pittsburgh Medical Center neurologist and critical care doctor. Now, for the first time, 3 large U.S. medical centers are preparing to publish data on the stroke phenomenon. There are only a few dozen cases per location, but they provide new insights into what the virus does to our bodies. A stroke, which is a sudden interruption interruption of the blood supply is a complex problem with numerous causes and presentations. It can be caused by heart problems, clogged arteries due to cholesterol, even substance abuse. Many strokes often don't cause permanent damage and can resolve on their own within 24 hours, but bigger ones can be catastrophic. The analyses suggest coronavirus patients are mostly experiencing the deadliest type of stroke known as large vessel occlusions, or LVOs. They can obliterate large parts of the brain responsible for movement, speech, and decision making in one blow because they are in the main blood supplying arteries. Many researchers suspect strokes in COVID-19 patients may be a direct consequence of blood problems that are producing clots all over some people's bodies. Clots that form on vessel walls fly upward. One that started in the calves might migrate to the lungs, causing a blockage called a pulmonary embolism that arrests breathing, a known cause of death in COVID-19 patients. Clots in or near the heart might lead to a heart attack. Oh, mercy. Another common cause of death. Anything above that would probably go to the brain, leading to a stroke. Robert Stevens, a critical care doctor at Johns Hopkins Hospital in Baltimore, called strokes one of the most dramatic manifestations of the blood clotting issues. We've also taken care of patients in their 30s with stroke and COVID, and this was extremely surprising, he said. Many doctors expressed worry that as the New York City Fire Department was picking up 4 times as many people who died at home as normal during the peak of infection, that some of the dead had suffered sudden strokes. The truth may never be known because few autopsies were conducted. Child said one question is whether the clotting is because of a direct attack on the blood vessels or a friendly fire problem caused by the patient's immune response. In your body's attempt to fight off the virus, does the immune response end up hurting your brain? She asked. Child is hoping to answer such questions through a review of strokes and other neurological complications in thousands of COVID-19 patients treated at 68 medical centers in 17 countries. Thomas Jefferson University Hospitals, which operates 14 medical centers in Philadelphia and NYU Langone Health in New York City, found that 12 of their patients treated for large blood blockages in their brains during a 3-week period had the virus. 40% were under 50, and they had few or no risk factors. Their paper is under review by a medical journal, said Pascal Jabbar, a neurosurgeon at Thomas Jefferson. In the vast majority of younger adults, COVID-19 appears to result in mild illness and with the risk of more severe consequences rising with every decade of age. According to Centers for Disease Control and Prevention data, 0.8% of U.S. deaths as April 18th were in people ages 25 to 34, 2% among those 35 to 44, and 5.4% among those 45 to 54. Jabbar and his co-author, Eaton Ross, an assistant professor of neuroradiology at NYU Langone, said that strokes in COVID-19 patients challenge conventional thinking. We are used to thinking of 60 as a young patient when it comes to large vessel occlusions, Ross said of the deadliest strokes. We have never seen so many in their 50s, 40s, and late 30s. Ross wondered whether they are seeing more young patients, because they are more resistant than the elderly to the respiratory distress caused by COVID-19, so they survive the lung side and in time develop other issues. Jabbar said many cases he has treated have unusual characteristics. Brain clots usually appear in the arteries, which carry blood away from the heart, but in COVID-19 patients, he is also seeing them in the veins, which carry blood in the opposite direction and are trickier to treat. Some patients are also developing more than one large clot in their heads, which is highly unusual. We'll be treating a blood vessel and it will go fine, but then the patient will have a major stroke because of a clot in another part of the brain, he said. At Mount Sinai, the largest medical center in New York City, physician researcher Jay Marco said the number of patients coming in with large blood blockages in their brains doubled during the 3 weeks of COVID-19 surge to more than 32. Even as the number of other emergencies fell, more than half were COVID-19 positive. It isn't just the number of patients that was unusual the first wave of the pandemic has hit the elderly and those with heart disease, diabetes, obesity, or other pre-existing conditions disproportionately. The COVID-19 patients treated for stroke at Mount Sinai were younger and mostly without risk factors. On average, the COVID-19 stroke patients were 15 years younger than stroke patients without the virus. These are people among the least likely statistically to have a stroke, Mako said. Mako, who has spent his career studying strokes and how to treat them, said he was completely shocked by the analysis. He noted the link between COVID-19 and stroke is one of the clearest and most profound correlations I've come across. This is much too powerful of a signal to be chance or happenstance, he said. In a letter to be published in the New England Journal of Medicine next week, the Mount Sinai team details 5 case studies of young patients who had strokes at home from March 23rd to April 7th. They make for difficult reading. The victims' ages are 33, 37, 39, 44, and 49, and they were all home when they began to experience sudden symptoms, including slurred speech, confusion, drooping on one side of the face, and a dead feeling in one arm. 1 died, 2 are still hospitalized, 1 was released to rehabilitation, and 1 was released home to the care of his brother. Only one of the 5, a 33-year-old woman, is able to speak. Oxley, the interventional neurologist, said one striking aspect of the cases is how long many waited before seeking emergency care. The 33-year-old woman was previously healthy but had a cough and a headache for about a week. Over the course of 28 hours, she noticed her speech was slurred and that she was going numb and weak on her left side, but the researchers wrote delaying seeking emergency care due to fear of the COVID-19 outbreak. It turned out she was already infected. By the time she arrived at the hospital, a CT scan showed she had 2 clots in her brain and patchy ground glass in her lungs. The opacity in CT scans that is a hallmark of COVID-19 infection. She was given 2 different types of therapy to try to break up the clots, and by day 10, she was well enough to be discharged. Oxley said the most important thing for people to understand is that the large strokes are very treatable. Doctors are often able to reopen blocked blood vessels through techniques such as pulling out clots or inserting stents, but it has to be done quickly, ideally within 6 hours, but no longer than 24 hours. The message we are trying to get out as if you have symptoms of stroke, you need to call the ambulance urgently. As for the 44-year-old man Oxley was treating, doctors were able to remove the large clot that day in late March, but the patient is still struggling. As of this week, a little over a month after he arrived in the emergency room, he is still hospitalized. And this said information is brought to you by the Washington Post. Sorry, so long. So as you see, more patients are having strokes. They are in their 30s, 40s, and 50s. They're seeing this type of stroke mainly in people who are in the age range of 74. So we have gone from a virus that affected people 60 to 65. It then went to people with underlying conditions such as diabetes, heart disease. It then went to all different age groups, including children and infants who died from COVID-19. Then it was a matter of covering your face and your hands while being out. Now it's anybody and everybody. Now it's a matter of causing problems to your heart, your intestines, your brain, your liver, kidneys, and now having strokes. So if you're having any pain in your legs, please go to the emergency room. If you're feeling numb on either side of your body, go to the emergency room. If you are having headaches, do not wait a week to go to the doctor, because a headache is a sign of COVID-19. A cough is a sign of COVID-19. Go get tested. More centers are testing for COVID-19, and it is a test that most of us will dread, because as I read the other day, they're wanting to stick a 6-inch swab down your nose for 15 seconds to get what they need out of there to test. And I've had that done many moons ago for whatever I went in for. And let me tell you, I didn't like it. I remember grabbing the nurse's hand. It's like an instinct to fight back once you get something down your nose. But that is the way they test you. So some of you may not want to be tested knowing that they're going to stick a swab down your nose, a long swab at that, but that is the way they do it. If you're not feeling well, you have to ask yourself, Do I sit here because I don't want to swab down my nose? Or do I go get tested and bear it for the few seconds so I can see if I'm healthy or not? And many people are walking around with no symptoms. That is the other thing, besides the strokes, the blood clots, and it affecting the heart. People are walking around with no symptoms and testing positive for COVID-19. And the one thing that is messed up about this entire situation is that it all started with sending people home to quarantine. And then those people getting deathly ill and having to go back to the hospital. Now people are walking around with no symptoms and testing positive. But the sad part is after you test positive, get well, then what? You're still going to be even more worried about catching COVID-19 again. Or if you test negative, you're going to be worried to death about catching it. So see, it's a flip of the coin. It's a roll of the dice. You're damned if you do. You're damned if you don't. And I think a lot of people will be worried if they go in tomorrow, get tested, come out negative, they're still going to be living in fear of catching this virus. And so far, there is no adamant proof that you can't recatch the virus if you've already been infected with the virus. This is an ugly virus that allegedly emanated out of China, and it has spread all over the world. And now the land of the free is the only country standing up with a high mark of COVID-19 cases. So you know I find that baffling. And this is the place where everybody wants to come to live and be and get on. But yet we're behind as far as locking the country down and adequate testing for the American citizens. Don't you find that ironic? Land of the free, home of the brave. Yet we're the only country with the highest statistics to date of COVID-19 positive cases and death. Not so free after all, are we? Praying for all of you out there. Please stay safe, wear your mask, your gloves. For those of you who don't want to adhere to wearing your mask and gloves, that's on you. But you should think about the other people that you may be infecting if you have it, and you getting it yourself and taking it back to somebody else, your children, your loved one, your parents, your relatives, your friends. And I see that now people are still running around, staying in people's faces and not wearing gloves and masks as if this virus isn't out there, and as if she's not taking names. She don't care nothing about your corona. Ain't you done figured that out? And this thing is ugly. And I say it's mutated because now you're hearing all these ugly things that it is doing to the human organs. There's no rhyme or reason to this virus. And no matter how you think it came to be, it is here. There is no cure and there is no vaccination. So instead of wondering about who gave it to whom, how it came to be, a setup, a conspiracy, a lab, this, that, China, the American government, focus on living. Because in the end, ain't nobody gonna stand account to say they deliberately planted a virus to kill off people for depopulation, maliciousness, or any other damn reason. Like, share, subscribe, drop your comments below. God bless all of you. Please stay safe. Wash your hands, keep up your hygiene, and put all masks and gloves in the appropriate receptacles. Until the next update, this is Everyday Shenanigans. Thank you. Good night.